Hello guys, my name is Moise and today I will talk about what is paracentesis, the reasons for paracentesis, equipments, preparations, and the methods for the paracentesis. Firstly, we need to explain the procedures to the patient and obtain informed consent. Paracentesis is a sterile procedure, thus sterile gloves and surgical masks are required. For equipments, we need to have a disposable container, iodine solution 5%, sterile gauze, a skin marking pen, a 10 ml syringe, a 22 to 25 gauge needle, an over the needle catheter, a scalpel, and last a high pressure drainage tubing. Firstly, mark the side needle insertion with a skin marking pen. Remember, the position for the patient is a supine position. Prepare the site with an antiseptic solution, which is iodine. Before starts the procedure, bedside ultrasound should be used to find an appropriate location that contains acidic fluid. The patient needs to raise arms above the patient's head because any sudden movement can dislodge or move the needle. There are a few reasons for paracentesis, which include severe abdominal pain, abdominal distension, unexplained fluid in the abdomen, concern for abdominal fluid infection, and to relieve pressure in the abdomen caused by large amounts of fluid. And the goal for paracentesis is to remove fluid from the abdomen. Then, apply a sterile drape along with an antiseptic solution on the injection site. Next, by using a 22 gauge needle, anesthetize the superficial skin with local anesthetic such as lidocaine. Continue this procedure to the deeper tissues by pulling back on the syringe by every 2 to 3 millimeters. The puncture is to be performed according to the midline of the abdomen, and it is recommended 2 cm below the umbilicus in the midline and either left or right of lower quadrants. Firstly, an angular entry technique in which the cutaneous site of insertion do not directly overlie the site of penetration into the peritoneal cavity. Another method is a Z-track technique. In this method, the cutaneous tissues are pulled about 2 cm prior to needle insertion and advancement through the perineum. When the catheter is withdrawn at the end of the procedure, the cutaneous entry site will retract to its original position. This will minimize the acidic fluid leaking. Next, advance the catheter through the epidermis and begin by making a small puncture in the skin with a scalpel to facilitate advancement of the paracentesis catheter. Immediately stop the advancements once the acidic fluid begins to fill in the syringe and remove the needle. For a therapeutic large volume paracentesis, attach the high pressure tubing to the end of the catheter and then to the container. This is for the collection of fluid. Remember, monitor blood pressure and heart rate during large volume paracentesis. Once the desired quantity of fluid has been removed, withdraw the catheter and apply bandage. Complications are including hemorrhage, intra-abdominal organ injury, and inferior epigastric artery puncture. Thanks for watching and stay safe.